Welcome back. Well, with pregnancy comes weight gain. There's no way around it. But sometimes we end up weighing more than we should, and that can bring health complications to you and your baby. Let's learn more. Hey ladies, it's Girl Talk Tuesday again, and today we're at the Institute for Women's Health at the shops at Lincoln Heights, and with us is Dr. Henry Garza. How are you, doctor?
I'm fine, thank you. Thank you for being here
today.
Thank you.
So today we're going to talk about obesity in pregnancy. Now this is a tough one because when you're pregnant, you gain weight, but when is it too much?
You know, there are national standards for obesity, and we use a ratio of height to weight. It's called the body mass index. If the body mass index is above 30, then that's a patient with obesity, and we have special considerations for that during pregnancy.
Sure. Now, how can this affect a woman during her pregnancy?
The main consideration is what is it affecting, with her body? Can it cause her to have elevated blood pressure, for instance? There's a condition called gestational diabetes where, the babies can grow really big and the mothers can have blood sugar levels that are too high. And then there's, complications that can occur early in pregnancy. I guess it would be miscarriage, stillbirth, further in pregnancy. The risk of C-section goes up. And then the risk of other interventions for that baby also can increase.
How can we avoid becoming obese? Because you've heard of we eat for two when you're pregnant.
Right.
How can we avoid it?
I understand that whole concept, but I think the main thing that I talk to my patients about is, if you're planning a pregnancy, and we can have that visit preconceptually, in other words, before you decide that you're going to get pregnant, if you're struggling with your weight, we can help you with that. And if, in fact, you do become pregnant, then we can talk about some strategies early on to help prevent you from having excessive weight gain and some of the complications that we talked about before.
When a woman is obese during the pregnancy, how does this affect the baby?
Yeah, the typical thing is that the babies can grow at an accelerated rate. And so if they get quite big, then that can be an issue for us in terms of planning the actual delivery. Issues like increasing the C-section rate, other interventions to try to facilitate delivery of the baby. And then there's anesthetic concerns as well. Patients know that they can have an epidural when they come in labor, but perhaps if their anatomy is a little distorted, that might be a challenge for the anesthesiologist.
Right.
Might increase the need for blood products, might increase the risk of clotting, in their bloodstream. So there are pretty significant issues that we'll have to discuss.
Absolutely. That's very good advice. Now, I know obesity is a big deal right now.
Sure.
So thank you so much for the information you've given us today, Dr. Garza. Okay, ladies, obesity in pregnancy has a lot of risks to you and your baby. So come ask Dr. Garza. He's going to help you out.
Thanks.
And this is the Institute for Women's Health. They're on Hardy Oak Boulevard, Suite 230. You can call them at 494-2000. Also visit them online, ifwh.org. Find them on Facebook and Twitter at IFWHSA. Okay.